If you take a daily allergy pill, a sleep aid, or medication for bladder problems, give me the next 90 seconds of your attention. Because the connection between some very common medications and memory decline is one of the most researched topics in geriatric medicine. Yet many people have never heard about it. I'm Dr. Richard Whitfield, and before we begin, I want to make something clear. Every study mentioned in this video comes from published medical research. The sources are listed below so you can review them yourself. Tell me your age in the comments and let me know whether you take anything regularly for allergies, sleep, or bladder control. Stay until the end, because the number one item on this list isn't actually a medication at all. It's something most healthcare providers never calculate during a routine visit, and it may be more important than any single drug. To understand this topic, you only need to know one phrase: anticholinergic burden. Many different medications share a similar effect in the body. They block a brain chemical called acetylcholine. Acetylcholine plays a major role in memory, learning, attention, and alertness. When these medications are taken over long periods of time, especially in older adults, researchers have found associations between higher cumulative exposure and increased dementia risk. One of the most important studies was published in JAMA Internal Medicine in 2015. Researchers followed 3,434 older adults for more than 7 years and found that people with the highest cumulative exposure to anticholinergic medications had significantly higher rates of dementia compared with non-users. Another large study published in 2019 examined nearly 60,000 dementia cases and over 225,000 matched controls, finding similar associations across multiple drug categories. Let's look at the most important categories. Number 7. First-generation antihistamines. Examples include diphenhydramine, commonly sold as Benadryl. Because these medications are available over the counter, many people assume they're harmless. The problem is that they cross into the brain and contribute to anticholinergic burden. Researchers observed a dose-response relationship, meaning greater cumulative use was associated with greater risk. Ask your doctor whether a non-sedating antihistamine, such as loratadine, may be appropriate for you. Number 6. Bladder medications. One example is oxybutynin. These medications are commonly prescribed for overactive bladder and urinary urgency. Several studies identified this category as having one of the strongest associations with increased dementia risk. In some cases, newer medications such as mirabegron may be considered as alternatives. Always discuss changes with your healthcare provider. Number 5. Tricyclic antidepressants. Examples include amitriptyline and doxepin. Interestingly, many people take these medications for nerve pain or sleep problems rather than depression. Because they have strong anticholinergic properties, long-term use may contribute significantly to overall exposure. Depending on your condition, alternative treatments may be available. Number 4. Nighttime PM products. Many sleep products and nighttime pain relievers contain diphenhydramine. The front label often emphasizes sleep support, but the active ingredient may be the same antihistamine discussed earlier. Always read the active ingredients section rather than relying solely on the marketing label. Number 3. Older antipsychotic medications. Some older antipsychotics are occasionally used for sleep problems, agitation, or behavioral symptoms. These medications may contribute additional cognitive risks, including sedation and increased fall risk. If you or a family member takes one of these medications, it may be worth discussing the benefits and risks with the prescribing clinician. Number 2. Combination cold and sinus medicines. Many cold and flu products contain antihistamines that contribute to anticholinergic burden. Because these medications are often used intermittently, people may not realize how much cumulative exposure they're receiving over time. Again, checking the active ingredient list is essential. Number 1. Total anticholinergic burden. This is the most important point in the entire video. Research suggests that the risk isn't necessarily tied to one medication. Instead, it may be the combined effect of multiple medications taken together. A person might be taking 4 or 5 different drugs prescribed by different specialists, each contributing a small amount to the total burden, yet nobody adds them together. This is why pharmacists often use tools such as the anticholinergic cognitive burden scale to evaluate overall exposure. A simple question you can ask is, can we review my total anticholinergic burden and see whether lower burden alternatives are available? It's important to understand what this video does and does not mean. These studies show associations. They do not prove that every person taking these medications will develop dementia. You should never stop a prescribed medication without consulting your healthcare provider. The goal isn't fear. The goal is awareness. The most useful takeaway is simple. Ask your doctor or pharmacist to review your medications and calculate your total anticholinergic burden. That single conversation could help identify safer alternatives while still treating the conditions that matter to your health. If you found this helpful, the studies are linked below so you can review the evidence yourself.